Picture this. You get up from your comfortable chair as usual, but today, something doesn't feel right. A sudden stabbing pain zooms through your knee, followed by the all-too-familiar tightness, swelling, and stiffness, as if your joint is passively protesting every motion. Instantly, each step feels heavier, slower, and more cumbersome. It is not merely knee pain, it is something more profound, an insidious thief nibbling away at your independence and confidence little by little. Most doctors are advising us to rest more, take another pill, or just wait it out. But what if the true answer is not less movement? It is optimal movement. The proper type of movement doesn't only decrease swelling, it stimulates your body's inherent drainage system. It makes your knees cease resisting you and begin to work for you once more. Here in this video, I am not merely showing you 5 arbitrary knee exercises. I am presenting you with 5 effective tools to restore your strength, mobility, and confidence, one step at a time. They aren't on your own repeated tricks you've come across. You'll discover the logic behind every movement in a manner you've possibly never heard explained. And the last technique. It is a hidden technique. I've been coaching clients one-on-one for years. And now, for the first time, I am sharing it with you here. Before we dive in, leave your name and where you are viewing from in the comments. I'd love to know who is taking this ride with us. Exercise 1. Supported leg elevation. Gravity activated. We usually assume healing is a matter of resting, staying still, and letting the swelling subside. But your body isn't capable of healing from inactivity. It heals from gentle, mindful movement. And yes, gravity, if you know how to utilize it, is your best friend. When fluid accumulates in your knee, it is not only about discomfort, it is a sign that your body's drainage system has slowed down. What most people don't understand is that your calves, ankles, and even the small muscles in your feet are natural pumps for your lymphatic system. With every step you take, flex or lift your feet, those pumps get activated, pumping excess fluid back towards your heart. The catch: when knee pain makes you quit, that fluid remains trapped. That is where this initial exercise comes in. Supported leg elevation may seem straightforward, but it reinstates your circulation and carefully drains fluid from your knee. No squats, no stress. It is an intelligent, subtle restart for your recovery. I regularly instruct this to patients following surgery or during inflammation because it is that good. It lowers internal pressure, loosens stiffness, and says to your nervous system, we're moving again, we're healing. This is where your comeback starts. And all you need is a couch, a towel, and a few quiet minutes of attention. How to do it: lie on your back in a comfortable position. Your bed or yoga mat is just fine. Rest your legs on a couch, chair, or some pillows so that your knees are slightly bent and your feet are higher than the position of your hips. Slowly extend your toes in the opposite direction, then curl them back toward your body. Alternate both feet if you prefer. Do 25 gentle repetitions on each leg, breathing naturally. You'll feel a soft squeeze in your calves. That's your body's internal pump doing its job. This simple movement boosts circulation, activates your lymphatic system, and helps fluid drain out of the knee joint. Pro tip: if your legs start feeling warm or slightly tingly, good. That means your circulation is waking up. Do this once or twice a day, especially in the evening, to ease swelling and stiffness after long periods of sitting. Exercise 2. Elevated knee extension. Unsticking the stiffness. Ever feel like your knee is literally stuck in place? You're not imagining it. When fluid builds up inside the joint capsule, it behaves like glue, making your knee feel tight, heavy, or frozen. And here's the kicker: this rigidity isn't caused by weakness. It is caused by inactivity. Your knee is designed to move effortlessly with each step you take. But when you stop moving, everything that surrounds it, the ligaments, tendons, and synovial lining, begins to lose flexibility and moisture. The consequence: fluid accumulates where it shouldn't, and your knee loses its natural flow. That is where elevated knee extension comes in. A gentle but potent movement that allows your knee to rediscover rhythm without strain or force. Rather than pushing the joint to bend, we rely on gravity and the muscles in your posterior chain, hamstrings, calves, and the area behind the knee to pull excess fluid away and retrain flexibility from the inside out. Here is the actual magic. By lifting your leg and gradually extending your knee, you engage what is known as mechanical lymphatic flow, a built-in suction effect that is produced when soft tissues lengthen and let go. Throw in conscious breathing and gentle muscle engagement, and lo and behold, your body is its own best therapist. Most individuals shy away from stretching, because it connotes pain. But this movement is different. It is more of a release. Every repetition is like stripping away a coat of rigidity, one breath at a time. It is not about how far you can reach. It is about reminding your body that movement is still an option. And once it gets the message, healing starts taking off. How to do it? Lie on your back just as in the first exercise. Bend one knee with your foot flat on the floor. Now raise the opposite leg, holding it as straight as comfortable. Hold the back of your thigh with a towel, yoga strap, or your hands gently. From here, slowly extend your knee, bringing your heel toward the ceiling. Don't push it. Stop when you can feel a gentle, comfortable stretch, never to the point of pain. Then relax slightly. As you stretch, bend your foot toward your face to work the whole leg. Do this 10 to 15 repetitions on each leg, holding for 3 to 5 seconds. Breathe deeply. Inhale as you stretch. Exhale as you release. Pro tip: keep your abdominal muscles lightly engaged. This provides stability and stops strain in your lower back. Do this on a daily basis to enhance flexibility, drain fluid, and restore your knee's natural pain-free range of motion. Exercise 3. Isometric quadriceps contraction. The sleeping guardian behind every stable, powerful knee is a forceful quadriceps muscle, the real guardian of your joint. But with age, or when inflammation rears its ugly head, that guardian begins to doze off. The consequence: a loose, unstable joint that is prone to filling up with fluid. Here is the thing that most people don't know. Your quadriceps doesn't only assist in walking or climbing stairs, it really helps compress the joint space, aid in venous return, and even aid in fluid drainage within the knee. When your quads become inactive, your knee loses its natural pump, and swelling persists. That's why this next exercise, isometric quadriceps contraction, is such a quiet powerhouse. You're not moving the joint at all. You're simply pressing and holding. Yet behind that stillness, hundreds of muscle fibers are firing, waking up, and reactivating the body's natural fluid mechanic. Research indicates that frequent isometric contractions can markedly decrease pressure within the knee, increase stability, and increase your body's sense of joint position, a big plus for arthritic or older knees. The simplicity of this motion lies in the safety of it. You can perform it even during a flare because there is no bending, no stress, and no additional strain. You are just restoring a muscle that may have been dormant for years. Every time you engage it, you are speaking to your body: we're strong, we're stable, we're ready. Never underestimate stillness. Sometimes the most powerful movement is one you can't see, but feel deeply from the inside out. How to do it? Sit or lie down with one leg extended in front of you. Put a rolled towel or small pillow under your knee for support. The objective is easy. Push your knee gently down into the towel as if you are attempting to flatten. You should sense your thigh muscle, the quadriceps, contract and move up. Hold the contraction for 5 seconds and release slowly. Do this 3 sets of 10 repetitions on each leg. Breathe deeply through. Breathe in as you set up. Exhale on the contraction. Tip: if you don't sense your quad activating at all to begin with, don't worry. That is just fine. It might take a few reps for the muscle to really wake up. To progressively overload the exercise, you can put a light weight, like a small rice bag, on your thigh during the press. Practice this every day, particularly in the morning or prior to walking. It strengthens the knee, aids drainage, and returns stability to your whole leg. Exercise 4. Straight leg raise, from stillness to strength. If the first 3 exercises are to get your knee's internal mechanisms going again, this 4th one is to rebuild your strength, gently, safely, and on purpose. The straight leg raise is more than just lifting your leg. It's a message to your body that says, I'm ready to carry myself again. What makes this movement so powerful is how it strengthens your quadriceps, stabilizes your hip, and mobilizes your knee, all without putting direct pressure on the joint itself. Most people don't realize how closely connected the hip, thigh, and knee are. But when you lift your straight leg against gravity, you are not only working your thigh, you are also working your hip flexors, engaging your core, and initiating circulation all the way down your entire lower limb. Physiologically, this controlled motion triggers deep venous return, enhances muscular endurance, and enhances neuromuscular timing, the dialogue between your brain and muscles that instructs your leg to stabilize when and how. But more than the physical gains, this exercise does something more profound. Having the strength to bring your own leg up with ease and control restores a sense of confidence and autonomy. It is not strength training alone, it is emotional healing. because once your body can move with strength again, your mind begins to trust in healing again. How to do it? Lie on your back with both legs out straight. Bend one knee and place the foot flat on the floor to support your lower back. Now, with the other leg straight, contract your thigh, engage your quadriceps, and lift the leg slowly until it is roughly level with your bent knee. Hold for 3 to 5 seconds. Then let it come back down slowly. Do 3 sets of 10 to 12 repetitions on each leg. Maintain a flat back, don't arch, and subtly contract your core throughout the exercise. Maintain a pointed foot towards the ceiling to ensure correct muscle alignment. If it is not challenging enough, incorporate a light ankle weight of a pound or 2, or even a water bottle wrapped around close to your ankle. Done regularly, this exercise doesn't merely increase muscle, it rebuilds faith in your body. Gradually, you start to trust again that your legs can actually hold you up. Exercise 5. Patellar mobilization and self-massage. Release to recover. Few people pay attention to the front of their knee. They ice it, rest it, perhaps stretch it, but not often touch it with intention, and that is a lost chance. Because underneath that puffy, stiff sensation is usually a jammed patella, your kneecap, enveloped by confined fluid, constricted fascia, and small adhesions that hold it back from moving freely. Here is the better news. Your hands can become one of the strongest healing tools you possess. With gentle massage and patellar mobilization, you are achieving 3 essential things: stimulating blood flow to feed the joint, promoting lymphatic drainage to help fluid move out of inflamed tissues, and releasing small adhesions that prevent your knee's smooth glide. And most importantly, this technique reconnects you with your knee, not as a condition to be cured, but as a component of you that is seeking to heal. When you combine this practice with mindfulness and deep breathing, it is not therapy. It is self-care, trust, and a whispered reminder. I am healing myself. Most physical therapists don't even share this outside of a clinic, but I think you should know how to take care of your body yourself, particularly when the answer is literally in your own hands. How to do it? Sit on a hard surface with your leg outstretched and relaxed. Put your thumbs lightly below the kneecap, with your fingers along the side. Start with light circular strokes around the patella. Move the tissue and skin, not merely the surface. This gets the area warm and increases circulation. Next, glide your fingers upward from the top of the shin toward your thigh, gently guiding fluid toward your lymph nodes. Do this for 1 to 2 minutes. Then, using both thumbs or fingers, slowly move your kneecap up, down, and side to side. Small relaxed motions only. Think of it as freeing space, not forcing movement. Close with broad circular motions across the knee, with a light oil or lotion like arnica or aloe to calm the tissues. Do this simple ceremony every day after your exercises. It doesn't merely decrease swelling, it makes your knee feel secure to move once more. Real-life advice for older adults. Progress is not from perfection, it is from patience. At 60, 70, or even 80, your body responds more to consistency than intensity. You don't require perfect form or overnight success. What you need is to show up, even on the days your knees are creaky or you are feeling unmotivated. Small steps, taken consistently, create big results. And pain isn't failure, it is feedback. Listen to your body, honor its boundaries, and believe that healing, as silent as it may be, always occurs when you move carefully. Each step you take forward is a win. You reached the end, and that is something. That means you haven't surrendered. You are ready to reclaim control. If your knees ever kept you from walking your dog, gardening, playing with your grandkids, or even standing without pain, listen clearly. Your knees aren't broken. Your body isn't finished. It is just inviting you to give it the right kind of care. These 5 exercises aren't merely movements. They're invitations. Invitations to remember your strength, your rhythm, and your internal healer. Every movement you make sends a subtle message to your nervous system. I am still here. I still want to move. I still believe in recovery. Will this journey be simple? There will be some days that lift you up. There will be others that test your patience. But if you remain consistent, if you respect your body not as a machine, but as an old friend to be treated kindly, it will repay you, slowly at first, then abruptly, and one day soon, you'll catch something different. The stairs won't feel quite so steep. The stiffness dissipates more quickly. You'll stand taller, move lighter, and walk with quiet confidence. If this video made you, leave a comment below. Not for me, but for somebody who needs hope today. Your comment could be what makes another person choose not to give up. You have a right to move freely. You have a right to feel strong. And this is just the start. Because what is next just may revolutionize the way your body heals forever.